Hello, Ms. Malasic. My name is Sarah Hansen. I'm a student occupational therapist from the University of St. Augustine. I will be working with you today. At first, do you mind just confirming your full name and date of birth for me?
Jade Malasic, July 30th, 1991.
Awesome. So after reviewing your chart, I saw that 2 days ago you recently had a left total hip replacement. Is that correct?
That's correct.
Okay. So today I would like to work on some of your daily activities, just going through them, making sure that you're doing them safely, and having you work on doing them independently. Doing those activities, there's just 3 precautions that we want to make sure that you do not break. So no breaking at the hip, so no going beyond 90, so, and no crossing your legs, so no adduction, and no internal rotation, so no pointing your toes in. Do you mind just repeating those back for me?
Yep. So we're not going to want to bend over 90. We don't want to cross our legs, and we don't want to point our toe in.
Awesome, good. So today I would like to work on doing some bed mobility, and then as well we're going to go into the restroom and go over how to do some bathing activities. Is that something you would like to do?
Yes.
Okay, do you have any questions for me before we
No.
begin? We're going to work on safely getting in and out of the tub. So during this activity, it's very important to remember your 3 hip precautions. So no bending at the hip, no crossing of the legs, and no internally rotating, so no pointing your toes in. Do you have any questions for me before we begin?
No.
Okay. So first I will demonstrate. I will use this other walker over here. So when you're coming up to the tub, it's important to turn towards your strong leg. So you'll come up here and you'll do walker, leg, and you're going to be turning towards your right side. So once you get up to the tub, you'll start turning, and during this turn, it's important that you don't break any hip precautions. So when you get towards the tub, you just want to make sure that you feel it on the backs of your legs. So you're going to reach for the guardrail, and then the other arm's going to reach back towards the tub. So when you bend, it's important to keep your back bent, extended, so you don't break that 90 degrees. So you can just push this walker out of the way, and you're going to slowly start to turn your body towards the tub. So moving your leg in and your other leg in, rotating around, being careful not to break that 90 degrees. So lift your other leg over, and then extend your leg and swing it over into the tub. And when you're sitting here, remember not to bend forward.
Okay.
So to help clean your lower body, you can use this extended sponge that you can just use to get your feet, get your toes, and then you can also use it to get your back without bending forward. We're going to do the same steps, just reversed. So you're going to extend this leg, and then you're going to start to rotate around. And when you get to this point, you want to start reaching for the other handrail. You're going to reach your other foot over and still start to just rotate around. And when you get to here, you're going to use your reacher to help pull your walker towards you. So for standing up, you're going to start to slide towards the edge of the chair, and you're going to make sure that both feet are touching the ground. And you'll count to 3, and you'll push up, leading with your hips. So 1, 2, 3. And then you want to put one hand on the walker. When you feel that you're stable, you can reach for the other hand. So next I'll have you demonstrate it for me. Do you have any questions though before we begin?
No.
Okay. Okay, so when you're ready, you can begin. Start walking forward towards the tub. Good.
Mhm.
And make sure that you don't break any of those precautions. Watch out for that toe. Excellent. Do you have any pain with this?
No.
Okay. Good.
Mhm.
And when you're ready, reach back for that guardrail. Good. And start lowering yourself down, making sure that you don't bend forward. Excellent. Okay.
Okay.
So when you're ready, I'll just remove this for you for right now, because I just want to be nearby if you need my assistance. But when you're ready, you can start rotating in towards the tub. Good?
Yep.
And use that right arm to hold that other guardrail. Excellent. Any pain or discomfort?
No.
Okay, good. So if you can, just demonstrate for me that you're able to use that sponge to help clean.
You would just use it for your lower legs.
Good.
Yep.
Very good. So when you feel ready, we'll just have you swing out and get out of the tub. Okay?
Okay.
Good. Making sure not to turn any of those toes. Excellent. So I'll bring this a little bit closer since I pulled it out, but at home you can use your reacher. Excellent. So on count of 3, we'll have you stand up. So 1, 2, 3. I'm just going to show you an alternative way of doing that activity. If that was a little difficult for you, there's a way that we can use this leg lifter to help guide you and give you a little bit of help during that transition. So I'll go ahead and demonstrate that for you so we know how to approach the tub. So I'll start from sitting down. So you'll be sitting down in the tub. You'll have your reacher or your leg lifter nearby. So you're going to start rotating around, making sure that you don't break 90. And when you get to about this point, you want to start reaching for that other handrail. And you'll reach for the leg lifter, and you'll lift your right leg over the tub, and you're going to place your foot in the loop. And you're going to help lift it and guide it over the tub. And then when you're at this point, you'll undo the loop and place it back by the edge of the tub. Do you have any questions for me?
No.
Okay. So a similar way of getting out, you'll use the leg lifter and you'll loop it around your foot and you'll lift it, guiding it over the tub, swinging around in your transition, lifting the other leg over the tub and pivoting around.
Okay.
Do you have any questions for me?
No, I think I got it.
Using the leg lifter to help guide that your left leg
Okay.
over the tub. Good. Good. Making sure you don't turn those toes in. Good. Good. Did you have any pain with that?
No.
Okay.
Oh, okay.
It looked good.
Okay.
Okay, so we'll just have you swing out of the tub as well. Oh, making sure you don't turn that toe in. Good. Reach for that other guardrail. Excellent. Work on bed mobility. So during this activity, it's important to remember your 3 hip precautions. So no bending over 90, no turning the toes in, and no crossing the legs. Okay?
Okay.
So I'm going to demonstrate this in the chair and just kind of talk it out. So you'll be laying down like that. So you're going to walk your hands up and you'll be on your elbows. And then you're going to bend in your right leg and this leg's going to be extended. And then when you're ready, you're going to start walking around slowly, making sure that you don't turn that toe in and don't cross over. So you'll get over to the front, bend the leg, and then when you're ready and feel stable, you'll push up, leading with your hips. Do you have any questions for me? Okay.
Okay.
So when you're ready, I'll have you demonstrate.
Okay.
So go ahead and start walking up on those elbows. Good. And then remember to bend this leg in. Good. And when you're ready, you can start shimming, turning around towards me. Good. Just making sure that you don't go slow so you don't break those hip precautions. Good. Making sure you can put both feet on the ground, and then when you're ready, I'm going to have you demonstrate standing up for me. Okay? So 1, 2, 3. Pushing up with the hips. Excellent. Do you feel lightheaded or dizzy at all?
No.
Okay. You can go ahead and sit back down, reaching back with those hands, and then lowering yourself down. Excellent. Did you have any pain with that?
No, I didn't.
Okay, so to make this activity easier, similar to the tub, we're going to have you use the leg lifter. So you'll loop your foot in the loop, and then you'll lift your leg and start turning in towards the bed, making sure that you don't rotate that foot in any direction and don't cross over. And then when you get to where you're facing the bed, you'll just unhook it, lower that leg, and put this off the edge of the bed.
Okay.
Do you have any questions for me?
No.
Okay, so I'm going to have you go ahead and demonstrate it this way. Good?
Yep.
And then pull that leg up. Good. And don't forget to bend this leg in when you can. Good. Good, and then just lower yourself back down. Good. Did you have any pain with that?
No.
Okay, good. So just for positioning purposes, I'll also mention that when you're laying in bed for a long period of time, it might be best if you put a pillow in between your legs, just so you don't feel tempted to roll in or cross over when you're sleeping or just relaxing.
Okay.
So we'll just put this here. Does that feel comfortable for you?
Yep.
Okay, good.